What if I told you that health has more to do with mindset than your DNA? Would you believe me? What if I told you that if that mindset was focused on what is beneficial for your body you could make better decisions so that your body could heal disease, reverse it naturally. So today we're going to talk about the mindset of nutrition. Many people think that if they give up a certain food or if they give up a certain thing, that it's not going to be healthy for you. But what if there are other options for you that you could choose for your body so that your body could naturally prevent disease? Well, today we're going to be talking about this with none other than Dr. Michael Klaper. As you recall, Dr. Klaper was my inspiration to do my 5-day water fast diet. It's still one of my highlights, and I want to go back and do it again. But Dr. Klaper is a gifted clinician. He is a sought after speaker, internationally renowned for his whole food, plant-based teaching. He also is passionate about teaching new medical doctors, new clinicians, and how to use lifestyle medicine to heal the body. And I'm excited. So make sure you have your pen and paper because we're going to be taking lots of notes today.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach and the host of the Lillian McDermott radio show. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Again, it's a treat anytime Dr. Michael Klaper comes into the classroom to be our teacher. And I am excited that he is here today, since it is our sole purpose in life to give and receive love and knowledge. I am grateful that Dr. Klaper is here to do just that. Welcome back, Dr. Klaper. It's been a year since you've been in the classroom, so we need to make it a priority to bring you in more. So thank you so much for joining us today.
Good to be with you, Lillian. You look lovely and healthy as ever, and
Thank you.
nice to be with you and your viewers.
Thank you. Thank you. I just turned 61, so I am really excited. Yeah, I'm excited to enter the 60th year and as healthy as I possibly can. That's why I've changed some things in my life. Changed the way, like I told you, that we were recording classes and we were doing things because I really do. I really do want to stay healthy for as long as I take that last breath, whatever that is, that's coming my way. But you know about this more than I do, because this is something that you've been passionate about your entire career, most of your entire career. So share a little bit about your background and how this passion developed for you to incorporate a whole food, plant-based lifestyle with your patients that you were seeing for medicine.
Well, we would have to turn the clock way back to the mid-1970s. I was a young general practitioner. I did my internship at Vancouver General Hospital in Canada and went into general practice ready to stamp out disease and suffering in the western part of the country. And I did everything I thought an erstwhile young doc should do. And my diabetic patients, I wrestled down their blood sugars with more and more insulin. My high blood pressure patients, I gave them more and more medication. And nothing was helping. After 4 years, my patients were getting more obese, more diabetic, more hypertensive. And I'm getting calls from the emergency room that Joe's in with a stroke and Mary is in with a chest pain from her heart attack. And I felt like a complete failure as a GP. So I left general practice and decided to become an anesthesiologist. And so I was an anesthesia resident for over 2 years. And I found myself on the cardiovascular anesthesia service, dealing with people's hearts and blood vessels. And day after day, I'm putting people to sleep and watching surgeons open their chest and open their coronary arteries in their heart and pulling this yellow guck out called atherosclerosis, which is clogging their arteries and leading to the heart attacks and strokes. And there were already studies in the medical journals saying that this stuff is largely the fat and cholesterol of the animals these people are eating, and that a plant-based diet can melt this stuff away. Reports way back in the 70s showed this. And that really resonated with me because my father died of clogged arteries. I know I've got those genes, and I was afraid that if I didn't change my diet, it was going to be my body on that operating table with that striker saw going up my sternum. I sure didn't want that to happen. And so I adopted a diet of whole plant foods. Well, my body loved it. Within 12 weeks, a 20-pound spare tire of fat melted off my waist. My high blood pressure went to normal. My high cholesterol went to normal. I felt great waking up in a nice lean body every day. And at this point, the light went on about why my patients were all getting more obese and sick and hypertensive from what they're eating. It's the food. It's the food. And at that point, I couldn't deny the truth in front of me, especially on the operating table every day. And I realized at that point I didn't want to be an anesthesiologist in my career, spending my years literally putting people to sleep. I'd rather go back to general practice and help them wake up, right? So much to my parents' dismay, with just a year left in my residency, I left. I said it's not in truth for me to be an anesthesiologist, as much as I appreciate the craft. And I returned to general practice. Found some people in my area in Central Florida, actually, who could give plant-based cooking lessons. And those patients who could follow that dietary style got the same wonderful results. They got leaner, their high blood pressure came down, their diabetes got better. I could stop their medications, something I was told never happened. And suddenly medicine became fun. My patients were getting healthy. And once that happens, you can't unring the bell. There's no going back at this point. It's the most satisfying kind of medicine I could ever hope to accomplish.
Mhm.
And that was 40 years ago. And I've been a plant-based physician ever since. And I'm the happiest doctor I know because my patients get healthy. So that's how I came to be sitting in front of you today and sharing this with your audience.
And I love your story. I love your story because you used your body as an example of what a temple should look like, and you brought it to your people. And like John the Baptist, you're John the Baptist. So with that in mind, we're talking about mindset, the mindset that can help us make better choices for our body. And I know that you and I did. You've done a video called the good, the bad, and the ugly of salt, oil, and sugar. I believe that that was the one of the topics that you and I have discussed, and I love that topic. So the mindset is that I'm missing out on meat. I'm missing out on, the things that I'm missing out of, and it makes it harder for someone to transition. First of all, did you find it difficult to educate your patients to trying something different and new? And how did you do that to get their mindset in alignment with wanting to reverse or disease?
Oh, Lillian, that's the crux of the issue today. Is it's one thing to understand the science about why a whole food plant-based diet reverses these diseases. That's all well and good, but how do you get real live human beings who grew up eating
Right.
an animal-based diet? This is the comfort foods that they love. They're grown adults.
Mhm.
With their habits firmly ingrained, their taste preferences firmly ingrained. How do you begin to turn that ocean liner of their life direction
Yeah.
in a different direction when it comes to food? And it's so intimate. It's easier to talk to people about a sex change operation than changing their diet. It's just remarkable, the resistance. And again, understandable. There's all sorts of cultural and personal reasons. So that question you asked, how do you get people to change? Because their life does depend on it. They're having chest pain. They're having small strokes. This is serious business. They really do have to change their diet. So how do you start? And this is the art of nutritional counseling, the art of lifestyle medicine. Yeah, everybody is different. You've got to meet them where they are. There can't be the slightest hint of judgment or finger wagging in your voice at all. The fact that they're sitting there at all in the office is wonderful. I wrap my arms around them mentally. That they're precious commodities at a very delicate time in their life.
Mhm.
And so I want to give them 100% support. I show them pictures and as far as what their arteries are looking like and how people, it solves their obesity problems, etc. And I get their interest up. But again, it's the food. It's the food. How do they? That's really where it comes to. So I start with we bargain here, and I want them to get through an eating day of healthy whole plant foods. That's the goal. So if they're breakfast eaters at all, I say, how about for let's do this for just 2 weeks, okay? I just want you to have oatmeal every morning with lots of fruit and sunflower seeds, pumpkin seeds, whatever you like, and we want a non-dairy milk, oat milk, soy milk, hemp milk, I don't care, just so let's have a healthy breakfast based on oatmeal porridge there. Yeah, I can do that, Doc. Okay, fair enough. And then I asked, talk about meeting them where they're at. I said, what's your favorite food? Oh, I'm Italian. Oh, I love my spaghetti and meatballs. Well, you can make spaghetti with really good marinara sauce, but instead of putting meat, ground up beef in there, let's do a pasta primavera. Let's chop up some veggies in there and let's make sure that the sauce is delicious and satisfying because it's really the sauces and the toppings that certainly give meat its flavor. You can't eat meat unless there's something on it, salt or barbecue sauce or ketchup. Well, it's the same thing. We want these sauces to be really inviting. And if they're from Asian extraction, if they're from India, we talk about plant vegetable curries. From a patient in Hong Kong who loves their noodles, and you can make noodle dishes with vegetables only. So we try. I don't use the word, but we veganize, their favorite dishes, and and educate them into batch cooking. Doc, I don't have time to spend in the kitchen chopping and cooking. You don't have to. You can buy vegetables all cut up, organic in a bag. There, throw it in your Instant Pot or on the stove. There, it's easy to make a stir fry, a soup, and make a big batch, and you can eat off of it for 2 or 3 days. You only have to cook once or twice a week.
Yeah.
And so it's putting these new ideas in their heads, but working with that platform of familiar foods. And people, if they make this much progress and then they backslide, wonderful. That's human nature, and you can't condemn them for it. But I want to see you back here in 2 weeks. Let's see how you're doing. And here's where the health coach it can be so valuable because there's someone to call if their willpower gets a little weak, and also if the agreement is you got to check in with your health coach once a week, and she or he's going to ask you, what do you weigh this week? What worked for you? What didn't work for you? If you know you got to report into your mentor there, boy, that's motivating. And so it takes a village. It takes group support because that's. I'm sorry, I'm going on here a bit, but
No, that's good.
but the hazard, of course, is the lack of support. If that person who really needs to change their diet, they've got angina, they're having stroke, but they're in a household where there is not only no support, but people are antagonistic, and that's rabbit food,
Yeah.
and when people slip back into their old habits, it's usually because there wasn't support among their friends and family. They got tired of feeling the odd man out at the restaurants or whatever, and it was just easier to acquiesce. And so again, the health coach, the dietitian, and the doctor, if they know they got to sit in front of the doctor once a month because he or she is following up, that's motivating. But it's again, yeah, as their weight starts coming off and they start feeling better and their bowels are moving better and their migraine headaches go away, that's the focus, how good you're going to feel. It's not what you're giving up. It's how your body is going to love this. You'll feel good, and that sword of Damocles of whatever bad diagnosis you've got, the artery disease or the migraines, whatever, that's lifted off your head, literally. And that's the best motivation, and just accentuate the positive, as that old song said. Really focus on the beneficial changes and help them. They're all precious, and the old saying that the folks who did, Doc, I did great, for 3 days, and then we went out for dinner. My sister-in-law came into town, and I had a terrible meal. And I smiled. I said, "Listen, one meal is not going to make the heavens fall down." And the old saying is, when the dog plays the violin, don't criticize the quality of the playing. The fact that they're playing it all, it's gorgeous. And and the fact that they made 3 days of healthy and wonderful, that's what to celebrate. Keep focused
Yeah.
on the victories there.
There's such a gentleness about you, and I'm sure that every patient that has come across your office or in front of you has been grateful for your love and compassion, because you yourself were that person that had to change that mindset. So you come from a place of knowing and experience, and the lack of judgment that you share, and that is such a breath of fresh air. Many doctors are overweight and smoke and drink and have the same diseases that they're prescribing medications for. And they basically don't know how to coach their patients other than make that prescription. So with that in mind, you did say earlier that food is an intimate thing. It's very intimate, that it's easier to change somebody's sex. I know that for those of you who are in the process of that, please, no letters. It was just a metaphor, and but I'm just saying that I remember when I walked away from animal products. My comparison is my parents would have been happier if I would have said I'm leaving my religion. They would have been happier with that than me not getting animal products into my system. And I was the odd man out, and I was made fun of. And not only that, I had food allergies. I could not have dairy. I could not have wheat. I could not have peanuts or almonds. And there were certain things that I just could not do. And so that made me even, back in the late 90s, when they started altering foods, I immediately felt it in my body. And so when you're the canary in the coal mine, and you're feeling things before everybody else does, and if they're not paying attention, then they just don't value the wisdom to changing a lifestyle. But 20 years later, plus 20, more than 20 years later, they're all changing their lifestyle as well, because it's unavoidable. We do need to take those notes. So with that in mind, you have taken this conversation to medical doctors with moving med forward.org. You're doing that with a lot of these doctors that are maybe in medical school or just getting started in their training and programming of what to prescribe. How is their mindset? How do you find that mindset? Is that harder to change than a patient?
Oh my, wonderful question. And the answer is yep, kind of, but in a different flavor, different channel. Let me explain.
Okay.
Um, it's glaringly obvious to certainly the general public and an increasing number of physicians, the astounding, appalling, there's no other word, the nutritional ignorance that most doctors have when it comes to counseling their patients about what to eat. Nutrition's never mentioned in 4 years of medical school. No one seriously mentioned it to me outside of a class on beriberi and pellagra, diseases that we no longer see. But the thought that the patient's diet is the driving force behind the clogged arteries, the high blood pressure, the diabetes, this is never mentioned in medical school. And it's the key to reversing these diseases. The concept of disease reversal is never really mentioned. In fact, the opposite is mentioned to the med school. The high blood pressure, they will take these pills the rest of their life, it's lifetime medication. Diabetes, one's on insulin, always on insulin. No one gets off insulin. Well, that's absolutely the opposite of true. These are reversible diseases, which no one, again, is mentioning to the med students. And after about 4 years ago, as I'm working with medical students and I see their nutritional blindness, not their fault, no one's telling about this. And I'm thinking, somebody should reach the medical students and tell them that one, these diseases that most of them are going to spend most of their medical career treating, no matter what specialty they go into. When they open their waiting room door, who's sitting there but Mr. and Mrs. America, overweight, diabetic, hypertensive, clogged up and inflamed. That's the general public in all specialties. So one, that these are reversible diseases, and two, a whole food plant-based diet is the key to that reversal. Somebody should tell the medical students this before pharmacosclerosis sets into their brain. They think that drugs and surgery are the only treatments. Somebody needs to reach them with it's the food, it's the food. And I think somebody should talk to the medical student. Somebody should reach the medical student. And a little voice on my shoulder said, "How about you, Doc?"
Yeah.
And so in 2019, I find myself flying from medical school to med school and giving the lecture of what I wish I learned in medical school about nutrition. And I tell the students, this is the lecture I wish someone had given me 50 years ago when I was a first-year med student. It would have changed the course of my entire medical career, would have changed
Yeah.
every diagnosis I made, changed every treatment plan I recommended. And so I'm telling you, as an experienced clinician, it's the food.
It's the
And
food.
the dietitian a plant-based dietitian belongs on the primary care treatment team. She should see, or he should see, the patient along with the primary care doc, and both the doctor and the dietitian should follow the patient along every month to make sure that the diet is having its desired effect. And the response we're getting is tremendous. The students are hungry, pun intended, for this information because it's the most powerful tool that they'll ever have as clinicians. In medical school, you want to get those powers. You want to learn how to use diuretics to make that edema go away. You want to learn how to use antibiotics to make that pneumonia go away. But this is the most powerful tool of all. It makes all these diseases truly better, not just masking the symptoms. And so the students are very receptive to this.
Good.
And then along 2020, along comes COVID. And so medical students don't want to gather in an auditorium anymore for a lecture. And so we went online, we went electronic. And actually it allowed me to reach even more medical students.
Isn't that wonderful?
It really is a silver lining, a left-handed blessing there.
Yes.
And so I spoke at Harvard 2 weeks ago, and I spoke at Rutgers 2 months ago, and I can appear at all these various medical schools and deliver this message. Now, parallel with this, there's this wonderful organization, the American College of Lifestyle Medicine, who tries to get to the root of these diseases, because they are lifestyle diseases, basically. And they certainly support a plant-based diet, but it's kind of an afterthought with many of the programs there. So I wind up speaking to the lifestyle medicine residents and lifestyle medicine students, saying plant-based nutrition is square one, is where to start. Yes, they need more sleep, they need more exercise, less stress. All those other pillars of lifestyle medicine are important. But if they're still eating cheeseburgers and buffalo wings and pepperoni pizzas, they're just not going to get healthier there. So that plant-based diet is key. And the reception has been very positive. Now, no one is Every once in a while, I get a professor in the back of the room with folded arms, clucking their tongues, because this is threatening. It threatens their intellectual model of disease, threatens their financial model. It's a disruptive approach, but it's the truth at this point. It's the food that these people are eating, and I've got a slide in my slideshow at the end that says I have all the major diseases: high blood pressure, diabetes, clogged arteries. And I said, knowing how reversible these diseases are with a plant-based diet and positive lifestyle changes. And I click to the next slide, and a big question appears. You want to heal these patients, or you just want to manage their chronic disease? Want to heal these people? Then get real about why they're sitting in front of you, doctor. Overweight, hypertensive, diabetic, clogged up, and inflamed from what they're running through their bloodstream every 4 hours. And until you deal with this, you're just treating symptoms. And you want to get healthy. Do they have to be 100% vegan? No. And I don't even use the V word. I don't want to put people off that I'm a sub rosa agent for the Vegan Society. And if they want to have a little piece of meat once a week or twice a week, fine. Lightning won't come out of the sky and strike them. But less is more. And the food stream should be whole food, plant-based, whether or not they want to put some animal flesh in from time to time. But the main food stream is the key. And
I
those are
like
the,
that.
yeah.
I
And
like that. But you know, the thing about the vegan word is that veganism has done the same thing to the food industry for vegan has done the same thing for veganism as the standard American diet has done for us as well. And what I'm saying by that is there are a lot of unhealthy vegan foods out there, but there's no doubt when you say whole food, plant-based, it's different than saying vegan. Can you elaborate on that?
yes, I mean, those four words are very powerful when put together in that progression. They're whole
Mm-hmm.
food, right away. Then, this has not been powdered and expressed and liquefied and dehydrated, whatever. It's foods like you could recognize them if you walked out in the garden. Oh, there's a tomato there, there's a cucumber there. Those are whole plant foods. Okay, that's the majority of what you want going down your gullet on a daily basis. As long as that's the major food stream, you're going to be okay. And whole food, plant-based, obviously. There's no animal products involved, or the least amount as possible. Uh, and uh, and that opens up this huge world. They think this is restrictive, but the reality is, no matter what culture they come from, there's most ethnic cultures around the world have a strong plant-based
Yeah.
history, tradition. And the Indian folks have their curries, and the Asian folks have their noodle dishes, and the Italian folks have their pastas, and in South America, the quinoa, the potatoes, these healthy starches with all these lovely sauces and legumes, and anything grows in a pot is a legume. So beans, peas, chickpeas, lentils. They show up with their protein rich complement there with lentil stews and bean burritos and hummus sandwiches and
You're making me hungry.
I'm hungry myself. The bean chilies. And so I tell them this is not a diet of deprivation. You're already eating these foods generally, but let's just clean up and let's turn them into a form that not only are healthy for you, but the beauty is, and without deflating the magic of it, from the scientific point of view, when you've got that plate of rice and beans and steamed greens on in front of you there with the lovely sauces. The majority of the food on that plate there, it's mostly fiber and water. The truth of it is, I'm just on a biochemical basis, and it doesn't stick to you. No matter if you go back for a third bowl of vegetable soup, who cares? It's fiber and water, and you pee out the water and you poop out the fiber, and you wind up lean and healthy. So the beauty of that is there's no calorie counting, there's no carb counting. It doesn't matter. Eat till you are full. I mean, how many apples can you eat? How many bowls of vegetable soup can you eat? And so it's joyful eating, it's guilt-free eating, yeah, as long as, again, whole food, plant-based.
Mhm.
You don't want to pour a lot of oil and salt and all that on it, of course. But it's a I show a slide of my professor of natural eating. I show this magnificent mountain gorilla putting leaves and fruit into his mouth. And I said, these magnificent creatures spend all day eating this high carb, high fiber diet. And guess what? They don't, and they develop all these wonderful muscles. They don't develop atherosclerosis, they don't develop clogged arteries, they don't develop type 2 diabetes, they don't develop ulcerative colitis in the wild. We should take and we have basically the same digestive system that they do. We should take their clue. A whole food, plant-based food stream is really the key to a long, healthy life. And you stay out of the clutches of people like me with MD after their name, which is a good,
It's a good thing. That's a good thing.
good.
Unless we want to go out to dinner. But
Yeah,
yes, that's a good thing to go out with an MD. But when you're talking about oil, salt, let's briefly go over how much oil is acceptable. I remember, and it has stuck with me, and I've shared this so many times, when you said to me that if you are eating something that is processed, of course, you want to get as much whole food plant-based, but if you are, the general rule is to look at the sodium, and if the sodium goes beyond the calories in milligrams, then it's not good. Do not have that. So
right.
share some of these tips on what to look for if you are having something from a box, if you are having oil, if you are having sugar.
Okay, important questions. Okay, and I did do a video on salt, sugar, and oil. It's on my website. You'll get a website later. So how do we sort this out? Well, we'll take the salt. It's a real issue. You need a little bit of salt every day, but it's in the food. It's in the veggies. It's in the food. Don't have to add any added salt if you don't want. And we're learning now how powerful too much sodium is as a disruptive influence. We know for years that too much salt in the diet will give you high blood pressure. That sets you up for heart failure and kidney failure, etc. But it's turning out, lo and behold, that too much salt in the diet really adversely affects your microbiome. The bacteria down in your gut, they don't like all that sodium. It distorts the microbiome into a less healthy assortment of organisms there. And also, we've recently learned that high salt diets stimulate immune cells, Th17 helper cells, that open the door to autoimmune diseases like lupus and ankylosing spondylitis. Who knew that high salt diets invite autoimmune disease in? So, so what to do here? Two things. One, recognize that because people will say, "Oh well, we took the salt shakers off our table." Actually, that's the one place that you have control over the salt that's actually going into your body, because the majority of salt, it's in the processed foods. It's in the spaghetti sauce at the Italian restaurant. It's in the soy sauce in the Asian restaurant and the frozen dinners. That's where the sodium already is, and you can't do anything about it. You barely even taste it. It's melted in with the food there. But that's where so many Americans are getting in trouble. So again, all the more reason, one, do as much cooking at home as you can. Don't cook with the salt because you can put in a lot and you don't even taste it.
Mhm.
Add the salt at the table, a few crystals of salt on the surface of your corn or your veggies. You get a big salty flavor hit as those crystals hit your tongue for very little actual sodium. So that's the one place you do. It's okay to use some little bit of salt there. But I've been learning how to, because I'm a recovering saltaholic. I used to put salt on everything. And so I'm learning to entertain my tongue with non-salty flavorings. And so I've become a big fan of lemon juice over my greens and all these lovely balsamic vinegars that are around. We got a whole assortment of them to put on our greens. And if you just Google homemade salt substitutes, you'll get recipes for that you can make in a coffee grinder. You put in these various herbs and you have a lovely salt substitute that you can sprinkle on your veggies. So the less added salt, the better. And watch the restaurant foods. Hold that to a minimum. And the processed foods, hold them to a minimum. Again, those whole food, plant-based. Mother Nature doesn't make them very salty, and we should take her guide off of that. Um, the other two,
I have a quick
oh,
question. I have
yeah,
a quick question. So I have reverse osmosis water. So
okay.
it mineralizes it, but it's very little. And I was told to add a pinch of sugar, and I use like a Celtic salt, and I take a pinch of it anytime that I have a big jug of water. I just put a pinch of salt. Is that even, should I even bother even to do that?
Oh, yes, it's a lovely thing to do. Water that is totally devoid of minerals. It tastes kind of flat. That's one complaint people have about distilled water, that there's no minerals in it, and it tastes kind of flat on the tongue. And a little pinch of salt in a gallon of water is fine. That's not the problem. Again, it's that hidden salt in the spaghetti sauce
Okay.
that's caused the problem.
Yeah.
So no, especially if that little pinch of salt makes you drink more water, it makes the water more inviting for you, all the better, because we all probably drink more water.
Yeah.
So, so no,
Yeah.
that's an appropriate thing to do. And you raise an interesting point that the toxicologists who deal with poisons, their watchword is the dose makes the poison. Everybody can handle a little bit of arsenic, a lot of it is going to hurt you. And the same thing, the pinch of salt for a little bit of taste flavor, that's fine. But again, it's the large amount in the food. And that transfers to the other two, to the sugar and to the oils.
Hmm.
A little bit of sugar in your tea is not going to cause a problem. But when you're eating a chocolate bar, you're eating a vegan donut or vegan cupcake, you're eating sugar as a food. That's a chunk of sugar in your hand. And when you eat it, it floods your tissues with fructose and dextrose and maltose that stick to your proteins. It glycosylates your proteins and stiffens them, and then your own body heat oxidizes those proteins and to creates lots of free radicals that damage the crystalline lens in your eye for cataracts and wrinkles your skin as it oxidizes the elastin proteins in your skin. It's eating sugar as a food. That's nutritional abuse there. And so it's a flavoring, not a food. Okay, and similar with the salt there, a little flavoring, but don't go overboard. And the same thing with the oils. The We'll leave olive oil alone for a minute here, but just in general, the main complaint that us docs have with the oil is this. We are certainly not anti-fat. You need healthy fats in your diet. Your skin oils are made of fat. Your hormones are made of fat. Your brain is wrapped in fat. You need some fat every day. Our plea is to get them, like all the other animals, get them out of whole foods. Get your healthy fats out of avocados and walnuts and flax seeds and hemp seeds and whole olives. That's where to get it, rather than glass bottles where you pour this concentrated fat out of coconut or oil, olives, etc., onto your food. What's the difference? Why is it a problem? Here is the science behind our concerns. When you bite that walnut, in that there are micro droplets of walnut oil that have omega-3s and important lipids in it. But you chew up that piece of walnut and goes down your intestine, and it takes hours for your digestive enzymes to penetrate into the piece of walnuts, for the amylase enzymes to break up the sugars holding the micro droplet of fat, for the lipases to get in there and emulsify the fat. And as a result, the amount of fat that enters your blood, first of all, it comes in your bloodstream very slowly, in a very small amount. One pass through your liver and your muscles is pretty much gone. Doesn't have much of a pharmaceutical effect. But you take the coconut, olives as well, but certainly safflower, sunflower, to any of these liquid oils, and you pour a few tablespoons on your food, nothing slows down the absorption. That oil, that fat leaps into your bloodstream. Now you got a couple of tablespoons of oil floating in your bloodstream, and it starts having pharmaceutical effects in your tissues. It penetrates into the wall, into the artery linings, the endothelial lining, and keeps the endothelial linings from producing nitric oxide that lets the arteries dilate and maintain their flexibility. The fat works its way into into the muscle cells and liver cells, inhibiting insulin activity. So it increases insulin resistance, type 2 diabetes. The fat inhibits blood clotting. People fall, hit their head, they will bleed into the skull there. These are pharmaceutical effects that the liquid oils have that that fats in the food form don't have. That's the issue with the oils there. The olive oil seems to be, it has minimal adverse effect apparently, but it's mostly the extra virgin olive oil is extra virgin green because of the little micro chunks of olive floating in the oil. That's what that's where, well, then eat the olives, if you really, you don't have to pour all the concentrated fat on the on your food there. If you want the benefits of the olive oil, eat the whole olive. That said, I gave this lecture, and a man came up to me later and says, "Doc, I'm a chef in an Asian restaurant. Are you telling me that 3 drops of sesame oil in a stir fry is really going to cause any danger?" He said, "No, it's not." And a fellow that works in Italian restaurants, is a 1 teaspoon of olive oil on a salad really going to cause any harm? No, it's not. But folks who just pouring the oil, ooh, heart healthy Mediterranean diet, and they're pouring this oil in their food, and the coconut oil eaters and all that. No other animal does that. This is just not heart healthy. And those folks, oh, but they live a long time in Sardinia. Yeah, but it's in spite of the oil. It's because of all the vegetables they eat and the
Yeah.
physical exercise
Yeah.
they get from living on the side of a mountain and all the social support. It's not because of the olive oil. It's not
Yeah.
the magic ingredient. And finally, the worst is, oh, olive oil, then I can eat anything else past the meatballs because I've got olive oil on my salad or that Mediterranean diet. Stop kidding yourself. Your body's never not looking. There's no fooling it, and oil is an unnatural product. So a little bit for
It's
flavor.
when I heard you say that the Asian chef said that 3 drops of sesame oil, no, that is not what happens. I used to saute my vegetables with oil. That's how I grew up. That's what I was taught. And it's never a tablespoon because once those onions suck everything up, you need to add more oil. And so it's more oil, and then it's heated. And so I remember the first time, Dr. Klaper, I met this was back in 2015 when Dr. Furman was on my show for the first time, and he taught me how to do a steam saute or water saute. And I love cooking in my wok and making some stir fry. I might make some tonight. And I remember the first time sauteing with onions and mushrooms and garlic and doing all this stuff. I didn't tell my husband that I had not used oil. So I was just waiting and waiting to see if he noticed anything different in the food. And he did not.
Didn't.
But the calorie intake in that meal, not that we were worried about our calorie intake or anything like that, but for people that are concerned about doing too much calories without feeling hungry, that oil is going to add so much more calories, and you can add like a half a cup in a meal and still need more oil on top of it. So
Oh,
it's just my observation.
Oh, Lillian, you're just spot on with that. And a couple of things that one, this works anything wet will work in that skillet to saute your veggies in. And we use vegetable broth. You can buy a carton of it, but they have these concentrated vegetable broths, a teaspoon and a cup of hot water, stir it up and dissolve it and put that in and stir fry your veggies in a vegetable broth. If
Yeah,
you make a nice soup, take a couple tablespoons of the soup from last night. Works just fine to
yeah,
saute your veggies in. Anything wet will work.
yeah,
So you certainly aren't obligated to use the oil as you mentioned.
yeah,
And our tastes change.
yes,
A few weeks ago, my wife and I were out for a meal in a restaurant, and we saw side dishes, sauteed veggies. Oh, good. And well, they brought the sauteed vegetables. They were sauteed in oil. They were dripping with oil. Couldn't eat them. It was just, it was not appetizing at all.
Yeah.
To be mildly
Yeah.
worded there.
Yeah.
And our taste change after a few weeks. Your taste change. You won't miss it.
Yeah.
So good for you for making that transition. I encourage you
Well,
to.
you know, I thought but it's a science. It's really like for those of you who want to learn how to do a steam saute, this is what Dr. Furman told me. You heat up the skillet really hot until it sizzles, and then you start with the onions, and the onions will release that water, you know, some water, and then you can continue using that until it sticks and it starts turning brown or it starts getting translucent or whatever it is that you are seeing at the time. And so you add a little bit of water or I'm going to say it, you can put a little bit of wine in there, cook with the wine,
Yeah,
just
that
a
works.
little bit, just to give it that, and then it'll steam up. And once that steam happens, once again, you have that opportunity to kind of stir things up, add your garlic, add your mushrooms, add your peppers, and now you have the base. And you can even add your broccoli at that point, and then add some tomato sauce. I put some tomato. The stuff that I buy is organic. It's pommy from Italy, and it has zero sugar, salt or sugar added. It's just the crushed tomato in it, and you make that sauce, and it is so delicious.
Yes.
You don't miss anything. That garlic and the oregano and the basil and all that creates the most. I think that's what I was gonna do the stir fry, or maybe I'll do that one tomorrow, but I'll make the
Okay.
pasta primavera today. But that it's so simple, and but we complicate ourselves. And I just want to shift here a little bit because I do want to talk about the website and how to get a hold of me and how to get a hold of Dr. Klaper. I want you to go to whenyouneedafriend.com. If you want to know Dr. Klaper's information and you've received, and you're a subscriber, you've already received all his information. All you have to do is click on it and it'll take you to Dr. Klaper, and that's D-O. Well, you just click on it and it'll take you there. And it'll take you to all the information about Dr. Klaper. So please, when you go to whenyouneedafriend.com, please subscribe, like and follow me on all social media. Share this video with your friends. You know, people struggle unnecessarily because they don't know these little tips that will help their food taste better when their taste buds have been unhacked. I don't know if it's like the taste buds are taken over by the processed food industry. And all of a sudden you don't taste the food, you're just eating to eat. We have a dysfunctional relationship with our food, not just intimate, but dysfunctional as well. And so once you start learning these new truths, all of a sudden the food you're eating is delicious, and you're starting to see the side effect of the food, which is to you become healthier and happier, and all of a sudden your clothes are feeling different without having to use the word diet, which is great. And this is what we learn here. This is where you know, my registered service mark is. You can take a pill, you can take responsibility. Not that I'm against the pill. These pills can help you if you're there, if there's a crisis, but short term. Long term, there are these side effects that are just not good for you. So with that in mind, I want you to encourage you to check out all the different classes. Dr. Klaper has done a lot of classes with us. Check them out and start incorporating some of these tips into your lifestyle. Like he said, a little bit at a time, and just love yourself that way. Give yourself that grace to kind of get used to this, and do it a little bit at a time. If you can't do it cold turkey like I did, you can do it a little bit at a time. I'm a cold turkey kind of girl. So with that in mind, I want to encourage you to go to my sponsors page, support them the way that they're supporting the classroom. Check out my Shop Now bag. Some of these products are affiliate products, but they're all Lilly approved. Any way that you can help grow the classroom is very much appreciated. Sharing this video is helping the classroom grow. Putting emojis and making comments, all of that helps the classroom grow because the algorithms can't shut us up. And so we need to all work together to get this information in social media that is pretty much deleting everything that is healthy and good for you. So please be aware that this is happening in social media. I've had over 70 videos removed from the classroom, from YouTube and Facebook, well, mostly YouTube, have been deleted. And so I want you to be aware that there are other places like BitChute and my podcast. You can check all the podcasts. I don't think they've deleted any of my shows, but I just want to encourage you to be your own advocate, be your own MD, your own medical detective. Also, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month or a one-time donation of whatever it is that you can give. We are so grateful. The costs of doing the classroom have increased exponentially, and anything that you can donate would be very helpful. This is free information to you. And so we want to make sure that we can continue doing the classroom without too much of a burden on me. And so if we could all share it together, and it's not a burden anymore, it's a community that works together and loves and grows together. And so today I am just so grateful that Dr. Michael Klaper is in this community, and he is doing such a wonderful job at sharing this information without judgment, without blame or shame, just doing it from love. And you can go to DOCTOR Klaper, which is KLAPER.com. That's Dr. Klaper. Again, if you're a subscriber, all you do is click on his name and it'll take you there. But another website that you can find the work that he is doing is movingmedforward.org. Is it .org or .com?
.com.
.com, I'm sorry, .com. And that's where you can find some of this information where you can start taking control of your life, taking your health back. So Dr. Klaper, thank you so much. You could be anywhere. You could be eating right now, but you are sharing information with us that is life-changing. And many of these diseases, many, if not most of these diseases, are lifestyle choices, as we know. And so with that in mind, speak to someone who would rather take the pill than to change their lifestyle. We have about 5 minutes left in the program. What would you have to say to someone that is thinking that the pill is easier to take than to change their lifestyle?
These pills are very powerful, but they're a bit of a deal with the devil here, because we're aware that one, they often have side effects where there's a low-grade background nausea. You don't eat because you're just you don't feel like eating because you feel like you're going to throw up there, and who wants to live like that month after month? And second, as we know, you can't be on these pills forever. They're very expensive, and once you stop taking it, the weight comes right back if you haven't changed your diet. Now, the only use I find for these medicines is as a bridge to healthier eating. If to be on them for a month or two or three while you are learning how to transfer to a whole food plant-based diet, then fair enough. When you stop the pills, the weight isn't going to come back because your tummy is full of soups and salads and steamed veggies and curries that keep you nice and lean. So beware of the quick fix. And nobody knows the long-term effects. No one knows what it's like to be on these medicines year after year. What does it really do to your liver? What does it really do to your bone marrow? What does it really do to your nervous system? Don't expect these pills to somehow give you magical health and control over your body. They're a chemical crutch, can have a short-term use, but it's the food, it's the food, it's the food. We are plant-eating hominids. We need to honor that. We are not carnivorous apes. We are not processed foodivores. We are like our mountain gorilla cousins up there. So keep your belly full of whole plant foods, and you won't need those pills. You'll be able to eat all you want and still wind up in a nice, lean, healthy body.
I'm still laughing about the pharmacostenosis. That's pretty funny. For those of you who get it, it's pretty funny. So I know that if you go to your Dr. Klaper's website, there are videos that he's done that you could purchase. There's other ways that you could support Dr. Klaper, who has generously given up his time today and always is just willing to be so helpful. And when we're getting to the end of our broadcast today, or broad class, and anyone that's on the fence right now, they're hearing what you have to say. They may not have support at home. What is the first thing? What are some tips that they can do to
Right.
get started?
Okay, realize we're talking about your life here. We're talking about your health. Yeah, tell the audiences, God forbid you have a heart attack or a stroke. It's only you in that hospital bed. It's not your daughter-in-law. It's not the people at work. It's you. Okay, we're talking, and you're a grown man. You're a grown woman. It's nobody else's business what you order for lunch. And order, make a point to get a healthy breakfast, the oatmeal and the fruit, lunch, a soup and a salad and a sandwich. Just make it a hummus sandwich with tomatoes and lettuce on it there. And dinner, have a pasta with vegetables in it. Just find one breakfast, one lunch, one dinner, and start with that. And have 1 day a week of healthy eating, and then 2 days a week. And just say, all right, I'm gonna do this for 3 weeks. Okay, just give it a good 3-week try. And it's not like you're signing your life away forever and ever. But at the end of those 3 weeks, as you find yourself leaner and healthier, and your bowels are working better, and your skin is clearing up, hey, the food tastes pretty good, and it's doing good things in my body. So give it a try, and it's just food. We're not really asking you to design the Sistine Chapel here. We're just asking to have a soup and a salad and a sandwich for lunch, and just make them healthy versions of that. And your body will do the rest. Put good things in there, and good things are going to happen from the inside out, which
From
is
the inside out. That's right. I love it. I love the tie-in. And it's funny that you would say it's none of your business what you eat for lunch. It's none of anybody's business what you eat for lunch. I always say it's none of your business what people think of you. And now I've gotten it's none of your anybody's business what you order for lunch. That's great. That's a great food for thought. And I am gonna go now and make myself some delicious food for me and my husband. And of course our granddaughter's coming over. And so we're gonna be sharing that food with her. 3-year-old loves broccoli, loves all these foods, fruits and vegetables. So I'm excited to be able to take care of her and feed her and love on her as well. So thank you so much, Dr. Klaper, for everything that you're doing and for the information. You always make it so you renew my commitment every time we talk together. So thank you so much.
Thank you. It's an honor and a delight to be with you and your audience. And the example you're setting for your granddaughter will change her life in a positive direction. We
I hope
don't
so.
underestimate the power of just who we are. People watch and they learn from our example. So
Well,
get yourself healthy, and everyone around you will get healthy as well.
thank you. And all of you, please share this video with someone you love. Make a comment about what is your commitment for your life. People say, oh, I don't have enough money to buy organic, or this is whatever they say, make up an excuse. But it's funny and interesting how everybody has the money to pay for their hospital bill. So just take it one step at a time, just like Dr. Klaper says, figure out one breakfast, one lunch, one dinner, and then add another one every day. And batch cooking is my best friend. So just enjoy, make it easy. It's not rocket science. It is absolutely the way things were created. So thank you so much for watching today. Please help grow the classroom by sharing this video and making some comments. And please remember, we'll be right here waiting for you worldwide at whenyounneedafriend.com. This is Lillian McDermott and Dr. Michael Klaper wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. That's great. It's the food.
It's the food.
You're so funny.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.